morning. We're here for the second press briefing for the Ebola outbreak in Summit County. We're not calling that yet, but we're here for the Ebola situation. First off, we're going to hear from our county executive, Russ Pry.
Thanks, Donna, and I want to thank everyone for coming out this morning. Again, our teams have been working since yesterday, and everyone is working together. Our public safety forces are communicating with each other. Our emergency management agency is taking charge, making sure that the Emergency Operations Center is open. I think that public health is doing a great job here, doing what they need to do to make sure that we eliminate the misinformation that continues to come out there. And we are continuing to get a lot of different misinformation. It's being tracked down, it's being eliminated. I believe Jean's going to talk a little bit more about what the realities are of when this young woman was here in town. Again, there are no confirmed cases of Ebola in Summit County, Ohio, as of right now. And we are all continuing to work very, very closely together to make sure that our public safety is protected. So with that, let me turn it over to Mayor Klein from Talmadge.
Thank you, Russ, and thank you all for being here today. Unfortunately, we have to be here today. We need to get the right information out, and I'd like to thank the health department and all the safety forces for their work helping us here in Talmadge. I just left Superintendent Ferguson's office before I got here to make sure the school district is being taken care of. They are put out checking their protocols and checking all their staff and making sure their procedures are in place. But things are going very well in Talmadge, and I just want to, again, down at the allotment on Stonegate, thank the media for keeping their distance away from the family members down there and all the residents there. So, again, just like to thank the health department for helping us out, and I'm sure we'll have more press conferences as this day goes on. Thank you.
Good morning. I'm Gene Nixon with Health Commissioner of Summit County Public Health. So we're 24 hours in, and I think in the last 24 hours we've learned quite a bit, and I want to share what we know, and I think a lot of that information is good. We also want to recognize the family. We know that they're going through a hard time and struggling with this disease, so we are thinking of them, and we want you to keep them in their thoughts as well. So first of all, I wanted to talk about the case in Dallas that was in town for a couple of days. She arrived on the 9th. She left on the 10th, and we've had several interviews with her family. We've talked to the Dallas Department of Health. The 13th, I'm sorry.
Arrived on the 10th.
Arrived on the 10th, left on the 13th. Okay. So we have talked to the Dallas City Health Department. We've talked to Texas Health Department, the CDC, the Ohio Department of Health. We've talked to her family, and she has been interviewed as well. So we have a pretty good idea of her itinerary while she was in town. She arrived. She spent most of that time at the home. Okay, she was not in, I want to make clear, she was not at football games. She was not at restaurants. She was not at a pizza parlor. She was not at the grocery store. She was in her home. She's a very conscientious young lady. The time that she spent in the community, I think she was aware of what she had been through in Dallas, and so while she was here, she was very careful around her family and anybody else that she was in contact. She did go to one store. She left. She did have some contacts there with some friends, and we've contacted every one of those people. Late last night, we finally got a hold of the last one. These people really didn't know each other very well, but we did track down 5 contacts, and each one of them have been very cooperative with us. They've worked very closely with us, and we actually have them in a voluntary quarantine at this time. And it is voluntary, whether it will be mandatory or not. Right now it's voluntary, and they're working cooperatively with us. We've also talked to the owners of the establishment. They are currently not working. We'll work with them throughout the day, and whether or not they go into quarantine is yet to be determined. We don't know what kind of contact they had with that case, so we'll continue to work with them today, and maybe later today we'll know more about that. Those individuals, I'm not going to name those people. We're not going to provide names. We're not going to provide where they live. I think legally we can't do that in public health, and I think ethically, I think we want to protect their privacy as well. I think that's what I have. We've got a lot of support. The CDC, I want to thank the CDC, the Ohio Department of Health, all of our local safety force partners, the EMA, our city and county support has been fabulous in the community, and I think that collaboration is helping us deal with this issue in a timely manner. So with that, I'll turn it over to Dr. Ermey to fill in any gaps.
Good morning. I'm Dr. Ermey from Summit County Public Health, Medical Director. And first of all, I want to reiterate what Mr. Nixon said, is that we have no cases of Ebola virus disease in Summit County. The second thing I want to say is that the only way someone can get Ebola virus disease is being in contact with someone who actually has Ebola virus disease. We have worked very closely with the family, and as Mr. Nixon had put out, looked at the interviews that Dallas had done with the healthcare worker. We have done multiple interviews to look at where the healthcare worker had been while she was in Summit County, who she had been with, to identify those contacts, and we think that we have identified all those contacts. It's a very limited number. So people who have not been notified by the health department that as being a potential contact are not really at risk because they did not come in contact with the ill person. People who came in contacts with contacts are still not at risk because none of our contacts as of today have shown any symptoms whatsoever. And they will be continue to be monitored for the recommended time frame that the Ohio Department of Health and the Centers for Disease Control will give us. The type of quarantine and the length of quarantine for the contacts is based on how much interaction they had with the ill person, looking at the type of interaction, the length of interaction. The Ohio Department of Health is releasing new guidelines, just released this morning, which we are reviewing and looking at what actions we need to take with these contacts. But as I want to say is, one, we have no cases. Two, we have identified contacts to the case that passed through here. And three, people who have some concerns or are not quite sure about what they should do, they can call our Summit County Public Health Call Center, which is 330-926-3939. Okay. Thank you very much.
Now we'll take questions from the audience in an orderly fashion. Sir.
How confident are you that you have reached all of the people who came in contact with Ms. Vincent?
Just stay up here.
We have reached all the people who have been identified to date. What we do is multiple interviews, because one of the things is, in a situation like this where there's illness, where there's concern, where there's anxiety, people may not remember everything the first time you talk to them. I'm sure if I asked any one of you, give me an hour by hour description of what you did a week ago and everybody you talked to, you probably wouldn't. But if I asked you the next day, you might remember, oh, I forgot that I was here, or I met so-and-so. So I think it's important to realize that while we did the interviews yesterday, that is not the end. We continually go back to ask for updated information. Did you remember anything else? Did you go someplace else? And I know that the Centers for Disease Control and Prevention team is doing that as well, and we'll look at putting all that information. But all the contacts that were identified yesterday through interviews with that the Dallas Health Department and Texas Health Department conducted with the healthcare worker, and we received those notes. The interviews that we've had with family, with contacts on several occasions to look at additional people, we have not found them. But again, we continue those interviews because people's memory sharpens once they have time to think about it.
Ma'am, is there
Cheryl?
a concern-
Right here, Cheryl?
So how many people are in voluntary quarantine now? You said the one yesterday, but how many family members and then how many acquaintances that you talked about? If you can elaborate a little bit more about where she went. Was it, you said a store establishment? I was unclear on where she went, if you could identify the place.
It was a retail establishment, and that's all we're going to say. Nope.
In Summit County?
Yes, it was in Summit County, but that's all we're going to look at for identification. Right now, we have 5 in Summit County and 2 in Cuyahoga County that were had some contact with the woman, plus her mother, who is still in Dallas. And we are not monitoring her. The Dallas Health Department's monitoring her. Cuyahoga County will look at monitoring the 2 up in Cuyahoga County. And we are working with the Cuyahoga County Board of Health to coordinate that, that monitoring so that we all know what the day-to-day results of the temperature checks and the symptom review are.
Okay, ma'am?
How long do you expect the continued follow-up to go on for, considering symptoms could develop down the road? Like you said, they might, remember new information.
Well, we'll be in contact with these people on a daily basis. That's one of the things, that they're not just put in quarantine and then we go at the end of the quarantine period and say, okay, you're released. We follow up with them every single day. So part of that conversation as to, and part of that is that we're actually at the house, so because we have to monitor the temperatures at least once a day, and then the other time they have to take the temperature while we are on the phone with them. So, and part of that conversation with them, how are you feeling? Have you had any of these symptoms? What's your temperature? Is anything else that you remember that you haven't, that you forgot or hadn't thought of before? So that's actually a continuous part, and that we do that with almost any communicable disease investigation, when we have multiple interviews, because we realize that people have memory bias, that they do not always remember everything you want them to the first time.
Okay, last row.
Hi, is there a concern?
Your name, please?
Pardon?
Your name, please?
Hi, my name is Sean.
Okay.
Is there a concern that the mother jumped on a flight to head to Dallas after having contact with her daughter?
The mother has no symptoms. The mother is a contact. And when you look at the incubation period is anywhere from 2 to 21 days, which is why we usually look at quarantine going out for 21 days. Average is 8 to 10 days. The mother still has no symptoms. So, in Dallas, so she's been there since the 14th. So she has had no symptoms. So at this point, there is no indication that the mother traveling was at risk. Remember, contacts have no symptoms. Contacts are not ill. Just because somebody's been exposed to a disease does not, or a person with a disease, does not automatically mean that they're going to be infected. So I don't think you can look at that as an absolute that somebody had contact with a sick person, therefore that contact is going to get sick. But that is why we do the close monitoring, because we cannot identify ahead of time, this contact's going to get sick and this one's not. But no, there was no indication that the mother traveling was at any risk. And the fact that she has no symptoms now, several days after she was on the plane, give more credence to that.
Is she quarantined or has any flight restrictions?
We have been told that she is in voluntary quarantine in Dallas. And Dallas, that's under their jurisdiction, Dallas Health Department jurisdiction, so they will be doing all the monitoring and follow-up with the mother.
Okay, ma'am?
Can you just confirm for me total contacts and total number of people in voluntary quarantines and differentiate the two?
I do not have the list of the total contacts right now, because our communicable disease unit is putting that together as we speak, and they will also be conferring with the Ohio Department of Health that has a staff member on site, and the Centers of Disease Control that has one staff member on site right now, and with other CDC members that will be coming in to look at making sure the list that we have, that all of them actually fit into the contact. Remember when you with Dallas, with the first gentleman, they put a very broad net initially and then narrowed it down to actually what constitutes a contact. And so that is what we're in the process of doing now. But the ones that we know that had that were named as having interaction with her over the weekend, those have been identified. They've all been interviewed. They're all under voluntary quarantine. None of them have symptoms.
So this 5 in Summit, 2 in Cuyahoga, and her mother, those are the voluntary.
Right.
Thank you.
Yeah, yes, sir.
So Dr. Ermey, she has one contact outside of the home with a market here. She was here planning a wedding. That's it? She stayed at the home this time, the whole time? Is that?
We have gotten that from multiple sources,
Okay.
including the interview notes that Dallas conducted with the healthcare worker. Remember, she was a healthcare worker who knew that she had been potentially exposed. She was what it appears to be that she was a very conscientious person, that she did not take undue risks. She seemed to limit her activity here, which I'm very grateful for. It appears to be that she took her responsibility as having been potentially exposed very seriously. And I think that is a credit to her, to the hospital, or the Dallas Health Department, for getting that information and for her following it.
If I may have follow-up then to that. Getting on a plane, maybe this is a question for the CDC, Dr. Ermey, and not you, but getting on a plane with an elevated temp, is that in your mind very conscientious?
From what we understood, she talked to the CDC. She had gotten permission from the CDC. And the elevated temp was a low temperature. It was low grade. We all probably, or many of us, if we took our temperature at the end of the day, would probably run the same level temperature and not be sick, because you have temperature variation during the day. But she apparently had checked and had been given permission as to whether, and so that was not a decision that she made on her own. She consulted the experts who dealt with the information and the knowledge that they had at that time. Now, is that going to change? Sure. But as I said yesterday, the guidance is going to change, and it's a good thing, because it means that we have learned from our other experiences and we're putting it into practice. If we had the same guidance today as we had back on August 1st, I'd be very concerned. But the fact that they are looking at updating that guidance with new information, I think is very important, and I look at it as a positive.
Did anyone from the Akron area speak with her, or is Dallas the only folks who have had contact with her?
Dallas is the only folks that have contact with her because of her health conditions. Now, if her condition improves, that they will allow us in Atlanta to talk to her, and we will check with the CDC about that, then we will look at getting additional interviews. And again, like I said, we look at doing multiple interviews. We'll talk to the family every day. We talk to the contacts every day. We would like to talk to her, because as she improves, she may remember things that she might not have remembered the day she was ill. So,
Are you saying she's unable to?
no, I didn't say. We're not able to talk to her. I don't know anything about her health condition down there.
Gentleman right here in the fourth row.
Have you can you be more specific on the ODH guidelines for quarantine, and have you notified the contacts whether they are direct or indirect, and how long they'll have to be in that?
No, I cannot elaborate more on that, because I've not read the whole thing yet, because I've been busy
Can I tell
this
you
morning.
what they know so far?
I have a gist of what they are,
Okay.
but we are going to be meeting with ODH and the CDC later today to go over that. So I do not have any information to share on that. Once we look at all the contacts and where they may fit in that stratified risk category, then we'll have more information.
Will that then, at the 3 o'clock news conference, you'll have a better idea then?
I may have a better idea. It may not be the whole picture.
Cheryl?
Can you
talk a little bit, because I'm sure there's going to be concerns when you say that she was out in a retail establishment. We're already getting calls from people who said Kent State should be decontaminated because she had relatives who work there. Are people at risk, whatever this undisclosed retail establishment is? Is there a need to clean it up, decontaminate it, or can you talk a little bit about that risk?
Okay, first to your Kent State. The people who were at Kent State were not sick. They were not shedding any germs. There is no risk to Kent State. The healthcare worker during this weekend did not step on the Kent State campus. Okay. So, again, looking at contacts, until contacts show symptoms of disease, they are not spewing out germs. And I think that's very important. Now, with the retail establishment, we, again, will be consulting with Ohio Department of Health and CDC as to what the different levels of interaction, looking at the new guidance that has come out, and seeing if anything else needs to be done than what we had anticipated doing yesterday.
What had you anticipated doing yesterday?
Following the guidelines from yesterday.
What
So,
would that be? Is there any kind of cleaning going on, or?
well, I think they're doing their regular cleaning, but there's no decontamination cleaning at this point, and we hadn't had any guidance either from the Ohio Department of Health or CDC as of yet that anything more needed to be done. Again, we'll be consulting with the CDC and Ohio Department of Health today to learn if there's anything above what had been planned yesterday.
Yes.
Jumping back just a little bit, whenever we're talking about whenever she was actually flying out of Cleveland Hopkins, you said that she had a low-grade fever, and she contacted the CDC, and they gave her permission to fly. Now, there's also been individuals coming out from the CDC now past that since saying she should not have ever flown. So, in your medical opinion, what are the odds that those that she had contact with then could potentially, the people they're interviewing in that situation, could develop symptoms down the road?
That is a question to ask the CDC, because they're the ones that made that decision. So I will let you wait until you find.
Medical opinion, though, can you give any idea?
I am not a gambling person. I am not going to give odds or statistics because I don't know what the level of interaction was. We are not involved with the follow-up with the flight because it came into Cleveland Hopkins. So it would be a very individualized basis, as it is for any interaction with a person with any communicable disease. So I can't give you the overall odds because it may vary from person in this seat, the person in this seat, the person that maybe she handed a magazine to or what. We don't know that. So without more information, it is difficult to just do an umbrella odds.
Okay, we have time for one more question. Blue shirt.
The business, is it open? I'm sorry if I missed that. Is it open for business today?
Actually, no. They have voluntarily closed today pending our consultation with Ohio Department of Health and CDC as to what else needs to be done.
And the five that are in voluntary quarantine, is anybody related to that business included in that tally, like the employees or the workers there?
The 5 that I mentioned did not include any of those. As to whether any of the other ones were put in there, I would have to get that from my communicable disease staff. I did not get a report on that this morning. But the 5 that I had mentioned in Summit County did not include that. It doesn't mean that they weren't, because I do know that they did voluntary close, and they may have, but I can't say that for sure.
Very quickly, is the CDC here? Can you just clarify?
We have from Ohio Department of Health, one Ohio Department of Health staff, and Centers for Disease Control, epidemiologic investigation officer who is assigned to Ohio Department of Health. So she's from the CDC, but has been assigned to Ohio Department of Health before this even happened. But they're also sending additional CDC staff to Ohio. And so currently, like I said, we have one person from the CDC and Ohio Department of Health on site, and then we have additional ones coming in to actually act as a resource for us. Because this is new.
Were those family members contacted?
We're not going to list the relationship, but they were,
So 5 Summit counties, 2 Cuyahoga counties.
right.
You're
And,
not telling us the relationship.
no, because that's not important.
Ma'am, is not naming the business that she visited, why don't you want the public to know that?
We don't want the public to know that because there's not enough information now to know if there's any problems. So why would you want to name something and then 3 days later find out there's no problem at all? It doesn't matter that we look at saying there's no problem. It would be out there. That business would unfortunately be blackballed for an unnecessary reason. So until we have any information that there is a risk to anyone, we are going to protect the privacy of the people there. It makes a lot of sense.
All right, that concludes our conference for this morning. We'll be back here at the same location at 3 o'clock for additional information as it becomes available. Remember, the number is 330-926-3939 to have anybody call for further information. Thank you.